This is looking at baroreceptors. So we talked about chemoreceptors. These are baroreceptors. And baroreceptors are stretch receptors. They are found in the carotid arteries and aortic or carotid sinus and the aortic sinus. This is going to show you, so they're stretch receptors. If they're in sinuses in the aorta and the carotids, so they're going to all of a sudden sense increased pressure or increased stretch. So remember, these are elastic arteries where they can be stretched out and then they collapse on themselves. So there's an increase in the stretch or the increase in pressure. It's stretched further, there's more pressure. So this is looking at blood pressure. If you show an increase in blood pressure, you actually decrease the respiratory rate. So you can see here, normal range and arterial blood pressure is going to be increased. Then you're going to decrease your respiratory minute volume. So what's going to happen is you're going to inhibit the respiratory centers, looking at the dorsal respiratory group in the medulla. And you're going to decrease your respiratory rate and decrease the amount of inhalations. So why do we kind of change based on blood pressure? So this is going to be where we don't need as much oxygen going to areas because we have an increased blood flow. So it's just kind of a compensation thing. If you decrease your blood pressure for whatever reason, and you're also going to see increased blood pressure. We didn't talk too much about it, but in the blood vessels, you're going to vasodilate. And for here, if you decrease your blood pressure, you're going to vasoconstrict, but you're also going to increase your respiratory rate. Because again, this is delivery of oxygen. So if you have higher blood pressure, your delivery of oxygen is pretty good. You don't need as much respiration. If your blood pressure is low, your tissues aren't getting as much oxygen because your respiratory rate is going to increase based on what's happening with the tissues. Enough blood flow to the tissues, enough oxygen, don't need it as much, can decrease the respiratory rate. Low blood pressure, not enough blood, not enough oxygen, you're going to increase your respiratory rate trying to get more oxygen into your blood. So you're going to stimulate the respiratory centers. We also have reflexes. So there are stretch receptors in the lungs, and that's specifically in forced breathing. So not your normal resting in and out. This is if you're trying to take a really, really deep breath or really, really, really push a lot of air out. And mainly this is going to be for kind of, again, breathe. You can't breathe. There's only so much you can breathe in, and there's only so much you can breathe out because of these reflexes. So the inhalation reflex is going to prevent you inhaling too much, that your lungs are overexpanded. And your deflation reflex is going to make sure that you can't deflate your lungs too far. So that's going to be in expiration. So deflation reflex is going to inhibit the expiratory centers and stimulate inspiration. So when the lungs are actually deflating, you're going to stop expiration. So deflating means they're getting smaller or shrinking. And you're going to stimulate inspiratory to cause your muscles, your respiratory muscles, to contract. So it's just also a natural thing, deflation reflex. Well, you want to stop deflation, so you stop expiration, and you want to inflate again, which is inspiration. So again, this is looking at the reflexes. So stretch receptors, these are in the smooth muscle around bronchioles. Remember, bronchioles have the smooth muscle. They can constrict and dilate. And they are stimulated when your lung is getting larger or expanding, meaning it's filling with air. Then what happens from these stretch receptors, we go to the medulla. So respiratory muscles are inhibited. So you're inhibiting the dorsal respiratory group. So inhalation stops. Then remember the expiratory, and this is when you need forced expiration, is going to be the ventral respiratory group. And you force exhalation by stimulating the neurons here. And they go to your accessory muscles to cause forced expiration. In the deflation reflex, then we have the opposite. So stretch receptors, these are in alveolar walls, and this is where the elastic fibers are. Again, we'll see that in lab specifically. There's elastic fibers kind of surrounding the alveoli that help with stretch and recoil. So once the alveolar stretch, then it stops and they snap back. So it has that recoil effect. When that happens, when the fibers are recoiling, this means it's deflating and getting smaller. So it's losing air because you're breathing out. Then you have the expiratory centers of the ventral respiratory group is going to be inhibited. And then you have forced inhalation because you're going to activate the dorsal respiratory group. So you also have the Herring-Brauer reflex, and it's an inflation reflex. Again, it's protective because you don't want to breathe in so much that you are overexpanding your lungs because you can cause damage to them. So this isn't, again, in quiet breathing. This is going to be in force where you're taking in really, really, really deep breaths. There's only so much air that you can take in before your body stops you. So when your lungs are kind of inflating, it'll stop and then it'll inhibit the dorsal respiratory group and go to the ventral respiratory group to cause expiration. And then we also have inhibiting the expiratory centers and stimulating the inspiratory centers when the lungs are deflating during forced breathing again. So we have kind of both ways. We're preventing overinflation, and we're also kind of stimulating breathing normally when we get back to when the lungs are deflating. This is looking at local regulation. So this is happening, what we say, in the lungs. So we're not talking about the dorsal ventral group, respiratory group, and the ventral respiratory group. This is in the lungs. So in more active tissues in the lungs, then the partial pressure of oxygen is actually lower and the partial pressure of carbon dioxide is rising. Why? Because you're using the oxygen to make ATP, and this is a waste product. So you have alveolar, so around the alveoli have capillaries to supply the tissues of the alveoli. So you regulate blood flow there. So you blood flows towards the lobules that have higher partial pressure of oxygen. Well, this means that there's more oxygen coming into those alveoli. Well, then if there's more oxygen in the alveoli there, well, we can have more blood flow there, more hemoglobin, more red blood cells that can pick up that oxygen to be used. If you have lobules that have a lower partial pressure of oxygen, well, instead of wasting our time and not having a lot of oxygen to be able to diffuse into our capillaries, we're going to constrict them. So there's actually different kind of areas that we can have blood flow to, and we can divert it to where we need blood flow and want blood flow. versus where not as much. And we can change. This is a fluid thing. Doesn't always mean every alveolar capillary is normally constricted or dilated. It changes based on what needs to happen. We also have, again, bronchodilation and bronchoconstriction. Remember smooth muscles in the bronchioles. When we change from bronchi and the many types, so segmental bronchi, and you go into bronchioles, you change from mainly cartilage to smooth muscle. With that smooth muscle, we can either constrict or dilate based on what's happening in the lungs. So the bronchioles can constrict when it's sensed that there's a high partial pressure of carbon dioxide. So they can actually get smaller. When they have a low partial pressure of carbon dioxide, they can get larger. So this is just showing you if there's a lot of carbon dioxide that's being lost, then you may want to slow it down because you may be losing too much carbon dioxide. So you're actually going to constrict to help maintain your carbon dioxide levels. If there's not a lot of carbon dioxide in the air that's being pushed out of the body, then you may want to be kind of keeping too much, meaning you're keeping too much on your body and you want to get rid of more. So you're going to dilate. So it's all in response again. The major response is going to be carbon dioxide partial pressure. But smooth muscle in the bronchioles allows you to open and close based on what the body needs and what the lungs need to do. We also have protective reflexes. So things like irritation, some sort of tickling, mechanical stimuli, something toxic that's sensed. Then you're going to have reflexes to kind of protect your lungs and your airways to make sure that they stay healthy. So we have a term called apnea. Apnea, again, A means without, and this is going to be without breathing, nia. So apnea is temporary suspension of breathing. And usually it's you stop breathing in, so you kind of hold your breath and then you push air out. So normal, you stop breathing when you sneeze. So you're not inhaling. You take a deep breath. A lot of times people take a deep breath, inhale, and then they sneeze and push all these kind of all the stuff out. Coughing's the same way. You take a deep breath oftentimes and you stop breathing, and then you're coughing, trying to expel things. During laughing, you actually stop breathing. So this is why some people are like, "Oh, I can't breathe," when they're laughing really hard, because you are stopping to breathe. So you have to take deep breaths in between. Yawning is the same thing, where you stop breathing just because you don't have kind of all the protective mechanisms to protect your airway. So you're going to just kind of stop breathing until you can get back to normal. Laryngeal spasms. So if your larynx isn't kind of opening and closing the normal way that it should, then you're going to stop breathing until you can get back to normal. We also have voluntary control up to a point. So we have subconscious control. So things like emotions, when you're crying, when you're laughing, when you're angry, all of that changes your breathing. If you kind of think about times when you've been crying, laughing, being very angry, your respiration changes based on your emotions. It's not necessarily that you think about it. You're not thinking breathe faster because you're crying, hold your breath because you're laughing, breathe faster because you're angry, or some sort of anxiety, all those things. You change your breathing rate, but you're not necessarily thinking about it. But it's not normal breathing. This isn't just the medulla oblongata has your normal rhythm, in and out, all of those things. This is changing based on your emotions. We also have conscious control where we are swimming, you hold your breath, and then you take a breath at a certain spot. Singing, speaking, all of those things are more conscious control because you can hold your breath and then you take a breath once you're done kind of speaking or singing. So this kind of slows overrides the respiratory centers again to a point. So this is overriding your medulla oblongata to not have the normal rhythm of breathing that you would if you weren't doing kind of all these activities. But it's limited. There's only so much time that you can hold your breath before your respiratory centers are going to take over. So there's only so much time you can speak or sing or hold your breath swimming until you are forced to breathe and your brain takes over. So these are going to be controlled again by your chemoreceptors. And again, the major one is going to be the partial pressure of carbon dioxide. Your carbon dioxide levels are going to change and it's going to take over. So the reflex of what happens in your medulla and your pons is going to take over and you will breathe no matter whether you want to or not. You have no choice.